and immediately got started getting involved in the community. They both exhibit pride and community spirit in Eastern Passage and Cow Bay. In June, Murray and Pamela commissioned a chainsaw artist to carve a sea serpent out of wood so it could be displayed in a local duck pond formerly known as Dan's Pond. The unveiling of the sea serpent turned into a community event where students from 3 elementary schools participated in naming the sea serpent. The winning name was CC the Sea Serpent. Murray and Pamela can be found volunteering and lending a hand at many community events. They are happy to give back to the community that they now call home. Thank you.
Thank you very much. We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is to the Premier. Yesterday, parents learned that teachers had voted 96% in favour of a strike mandate. Today, parents are hearing that school boards are preparing strike contingency plans and mailing them out to parents shortly. Mr. Speaker, the mess the Premier has made of these negotiations is getting worse and worse. Quite simply, parents expect their government to work out this impasse without a strike. I'd like to ask the Premier, does he still think today that the next moves are up to the union, or will he show some leadership and get back to the table and work out this impasse with teachers without a strike?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable for the question. As teachers made a decision a few days ago, Mr. Speaker, that they have the ability to go on strike. They've been given that authority to their executive. The executive will then determine whether or not they go on strike. In the meantime, we've continued to work with classroom teachers. We've made investments as a government over the last 3 years in classrooms. We've heard from teachers that they say that those investments needed to be in other areas that they wanted to see. We're reaching out to continue to work with them, but the decision on whether or not they go on strike will be up to the executive, Mr. Speaker, not to the government.
The Honourable Leader of the Official Opposition.
I guess the answer is no, Mr. Speaker, but here is how much of mess this government has made of the impasse with teachers. The Minister of Education is caught up in a dispute about which table they'll actually get back to work at, whether it's the minister's partnership table or whether it's the union's bargaining table, Mr. Speaker. Well, that's unacceptable to parents. Parents don't care which table they talk at. They just want the government to work it out without a strike. So the Premier has said that teachers have made a decision. I'd like to ask him to make a decision. Pick a table and get back to work. Stop this bizarre impasse about which table you're going to talk at.
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable for the question. And if he'd been paying attention over the last week, he would know the Minister of Education has reached out to the union and to the school boards to come to the table to talk about the challenges that are being faced in the classroom. We know they're real. We want to be partners with them. We want to make investments in the classroom. It's my understanding that the union has gotten back to the minister. That meeting will be ongoing, and we're going to continue to make sure that we improve classrooms across this province.
The Honourable Leader of the Official Opposition.
Well, I guess it's all up to the union now, even when the union gets back to them or not. The Premier doesn't seem to care. They're just going to watch what happens, Mr. Speaker. Well, meanwhile, parents are asked to make contingency plans for their kids. Mr. Speaker, meanwhile, as every day goes by, the chance of a strike happening gets greater because there's no leadership from the Premier or the Minister of Education. It's all up to the union what gets decided now, Mr. Speaker. Well, parents want to see some decisions from this government, including something as basic as which table are they going to sit at. So I will ask the Premier, while he fusses over whose table they're going to talk at, Mr. Speaker, does he have any idea what to suggest to parents who are now being made to make contingency plans about where to send their kids during the school day?
The Honourable Premier.
Mr. Speaker, there isn't a subject that comes up in this House that the Honourable Member doesn't want to spread fear about, Mr. Speaker. We're going to continue to work with the union classroom teachers, Mr. Speaker, to make sure that we continue to improve the learning environment. We've invested $65 million, Mr. Speaker, in education. We've hired over 500 new teachers for CAP classes, Mr. Speaker. We've brought in classroom teachers across the province, Mr. Speaker, to reduce outcomes. We've hired more math mentors, Mr. Speaker. We've hired, Mr. Speaker, mental health conditions. Is there more work to do? Of course there is, Mr. Speaker. We know there's more more work to do. We want to speak directly to classroom teachers now, Mr. Speaker. Obviously, the executive of the union didn't represent them when they came to us and asked us to make those investments where they wanted them.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, my question through you is for the Premier. Mr. Speaker, this government's promise of a doctor for every Nova Scotian is on life support. Speaking on a radio station this morning, the head of the family medicine for Western Zone said that Nova Scotians should not expect a doctor in every community. Mr. Speaker, this no doubt comes as a disappointment to many rural communities already feeling left behind by this government. So I asked the Premier, does he agree that Nova Scotians should not expect a doctor in every community?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. I am sure he's taken the doctor's comments out of context, Mr. Speaker, as he would know, Mr. Speaker.
Order, please. Order, please. The Honourable Premier has the floor.
Speaker, I'm sure the honourable member has taken those doctor's comments out of context, Mr. Speaker. Mr. Speaker, we're going to continue to work, Mr. Speaker. We're going to continue to work with health clinicians across this province to ensure that we put together the appropriate health care delivery team. Very proud of the fact of the nurse practitioners that we recently announced, along with family doctors, family nurse practitioners as well, Mr. Speaker. We're looking forward to continuing to build those practices. With that decision, 14,000 more Nova Scotians that access that team, and we're going to continue to build on that, Mr. Speaker, across our province and communities from one end to the other.
The Honourable Leader in the House of the New Democratic Party.
Thank you, Mr. Speaker. As the goal of a doctor for every Nova Scotian becomes less and less likely under this government, it seems the next strategy is to move the goalposts. Last week, the member from Clare Digby told this House that the promise will not be fulfilled tomorrow, not in a year's time, but 5 to 10 years, Mr. Speaker. I repeat, 5 to 10 years. I listen well, and I'll table that, Mr. Speaker. Funny, Mr. Speaker, I don't remember seeing that part of the promise. I must have not read the fine print. So I'd like to ask the Premier, does he agree with the member from Clare Digby that some Nova Scotians may have to wait 5 to 10 years for a family doctor, what I heard in this chamber last week?
The Honourable Premier.
Speaker, I want to thank the honourable member for giving me an opportunity to talk about my colleague from Clare Digby and the tremendous work he's doing. I'm looking forward to spending some time with him in his constituency in November. We get a chance to christen a new ferry down in Tiverton. Looking forward to see our former colleague that was in this House, who you replaced, Mr. Terrio. Mr. Speaker, the fact of the matter is this member has continued to represent that community from Clare, Mr. Speaker, to Weymouth, to Digby. We're getting positive traction, getting positive results. And, Mr. Speaker, I want to tell all members of this House how encouraged the people of Clare Digby are with the representation they're getting from that member.
The Honourable Leader in the House for the New Democratic Party.
Thank you. Mr. Speaker, I think what's most frustrating for doctors and patients alike is that this government does not want to admit that there is a growing problem here. Speaking about doctor shortage in Weymouth, the head of the family medicine for the Western Zone said, and I quote, "We understand the crisis that's here, but it's important to realize that part of the problem is that doctors simply aren't here to take this position we do have," and I will table that. So, Mr. Speaker, I asked the Premier, will he admit to this House today that his plan, I repeat, his plan to ensure a doctor for every Nova Scotian, if indeed there is a plan, Mr. Speaker, is simply not working?
The Honourable Premier.
Speaker, I want to thank the honourable member for his question. I'm sure the physician that he was talking to would tell you that new physicians across this province don't want to work in an old system that was continued to build under that government, Mr. Speaker. They want to work as in a collaborative practice team, continuing to build on that, Mr. Speaker. A team across this province. I was pleased to be in Digby when we opened one, Mr. Speaker. We know there have been challenges. We're encouraged by what we're hearing from medical students who want to come to rural parts of our province. I want to give Dr. Tom Mary, who was the Dean of Medical School, who instituted the Rural Residency Program, which we're now starting to begin to see positive results from that, Mr. Speaker. And we're going to continue to work with communities and the healthcare providers across our province. In some places, Mr. Speaker, it may be a social worker that we put part of that team to deal with socioeconomic challenges delivered in poor health. There's all kinds of different models that will work in communities. Be part of helping that make that happen.
The honourable member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. Mr. Speaker, my question through you is for the Minister of Seniors. Mr. Speaker, dignity must be the centre of care we provide for seniors and others in our long-term care facilities. The professionals who provide the care are struggling to do this because of Liberal cuts to nursing homes. We have heard reports from a long-term care facility that due to cuts, the budget for adult incontinence products has been reduced to $2 a day, which roughly equates to 3 incontinence products per day. So my question is, does the Minister truly believe that $2 a day is an appropriate amount for seniors? Are they being given the respect and the dignity they really deserve when the budget for these essential projects and products is so small?
The Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker, and I thank the member for that important question that he's brought to the floor today. As the member knows, well before any cuts, there were different models of delivering care in our nursing homes. It comes down to administrative decisions when a global budget is given. Right now, Mr. Speaker, we've actually have reached out to almost 100% of the nursing homes to in fact identify any deficiencies that they have that are different than before any reduction that was made in their budget.
The honourable member for Sydney River Myra Lewisburg.
Well, Mr. Speaker, it's typical of this government to cut and then find out what the consequences are. Mr. Speaker, the Liberal cuts to long-term care are affecting the quality of life of our loved ones. And Mr. Speaker, even this government says they aren't. According to an article published by Gary McLeod for the Chronicle Herald, he states that residents of long-term care facilities noted that they only receive 1 bath a week. And I'll table that, Mr. Speaker. Does the minister not realize that these cuts are robbing our seniors of their dignity and their quality of life?
The Honourable Minister of Health and Wellness.
Thank you very much, Mr. Speaker. As the member just alluded to, we have for-profit and not-for-profit homes in the province. He just spoke about one group of homes in the province. I get the fortunate opportunity.
The Honourable Minister of Health and Wellness has the floor.
I get the fortunate opportunity to go to nursing homes, meet many of the residents, and what I can tell the member opposite is that many of the administrators said that this was the first time they were ever asked to look at they're doing their business model differently, and I know that the quality of care in our nursing homes is exceptional.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Yesterday in the House, a very serious event occurred. The Minister of Education chose to read selectively from 2 letters she'd received from the Nova Scotia Teachers Union. These letters, one from 2014 and the other from 2015, were both complaints from the union that the minister had acted in breach of the Teachers Collective Bargaining Act and contrary to her duty as minister to bargain in good faith with the union. Oddly, the minister neglected to mention these important facts in context, and instead she tabled them in order to suggest the NSTU does not speak for teachers. I think 96% of teachers who gave the union a strike mandate would disagree. So my question today for the minister is, echoed by many teachers, will the minister apologize for her desperate attempt to discredit the Nova Scotia Teachers Union?
The Honourable Minister of Education.
Thank you, Mr. Speaker, and I would remind the member opposite that when any article, any item is tabled, it is there for its entirety, and I'm really pleased to see that she read it.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Well, that's interesting because I think every teacher across this province is reading it, and that's over 9,000 of them. Mr. Speaker, first this government threatened and disrespected teachers with Bill 148. Then they said that they were listening to teachers but still failed to meaningfully address their real concerns. Now they've attempted to discredit the very union with whom they're supposed to be negotiating. So my question is simple, Mr. Speaker. Will this minister and her premier agree to give up the mother and father knows best routine and get back to the bargaining table?
The Honourable Minister of Education.
Thank you. Mother and father, mother and son. Thank you, Mr. Speaker. And I would like to say to all of the teachers in the province of Nova Scotia that I have continued to have dialogue with their president as recently as this afternoon. We began meeting regularly when she became president. We will continue to do that because, Mr. Speaker, we both want the best for the teachers and the students in this province.
The honourable member for Pictou West.
Thank you, Mr. Speaker. Earlier this week, the Minister of Municipal Affairs said that while he was concerned about Richmond taxpayers footing the bill for dry cleaning, liquor, spousal travel and political contributions, he would not act until the RCMP completed their investigation. I was a little perplexed by that response because the people of Richmond don't need the RCMP to tell them that their money has been spent inappropriately. They want a government, Mr. Speaker, that has their back. So when will the Minister act immediately to ensure the misuse of taxpayer dollars does not continue in Richmond and will not be duplicated in other municipalities?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. We are acting right now. We've engaged our partners in a conversation around expense policy for the province. I think we have a great model here in this legislature where all of our MLAs post our expenditures online for everybody to see for public consumption. I think that is an optimal model that should be applied across the board with municipalities. Currently, there is not a standardized level of financial reporting and expense reporting. I think that needs to change, and we're going to do just that.
The honourable member for Pictou West.
Well, Mr. Speaker, I appreciate the minister's narrative, but that was a narrative that the reality of Richmond taxpayers really needed last year when they were requesting help. So the minister had lots of options, including legislation. The minister does not have to wait for the police to get serious about protecting taxpayers' dollars. So why is the minister afraid to tighten up the spending rules for all municipalities?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. And as I just mentioned, we are going to do just that. We're going to ensure that there's a standardized level of accountability and transparency for all of our municipal units. But what we're not going to do is have a knee-jerk reaction to this, treat all municipalities as if they're guilty of something, Mr. Speaker, when in fact they're partners, they want to help us do this, and they want to have a financial expense framework in place that Nova Scotians can have full confidence in.
The honourable member for Pictou West.
Thank you, Mr. Speaker. Yesterday, we learned that Elections Nova Scotia is investigating an issue that I have raised with the minister on 2 different occasions. Elections Nova Scotia is investigating Richmond County councillors claiming reimbursement for political contributions or tickets to political events. Unlike the minister, Elections Nova Scotia is not afraid to act. They are not hiding behind a police investigation. We know that Elections Nova Scotia is acting now, especially when they see something wrong. Why isn't the minister?
The Honourable Minister of Municipal Affairs.
Mr. Speaker, I'm glad the member pointed out that the issue is with those individuals and getting reimbursed for donations. It do not have to do with the donation themselves, but the fact of the reimbursement. That is the issue at stake. Elections Nova Scotia is the appropriate organization and authority to investigate issues that involve the Elections Act, Mr. Speaker. They are the appropriate organization. The RCMP is the appropriate organization to investigate alleged behavior that could have been in contravention of rules and regulations. They are the appropriate authorities, Mr. Speaker. The Ombuds Office is the appropriate authority to investigate concerns that come forward from citizens, Mr. Speaker. We are the department and authority that oversees the Municipal Government Act, Mr. Speaker, and when we're done with that act, we will have a system of financial expense regulation that this province will be proud of and have confidence in.
The honourable member for Pictou West.
Mr. Speaker, his department knew about it last year. You know, I've been raised that if it's important to you, you will find a way. And if it's not important to you, you will find an excuse. And your department found an excuse not to help back in 2015.
Please, I'd like to remind the honourable member for Pictou West not to refer to members opposite directly. The honourable member for Pictou West.
This much I know is true, Mr. Speaker, that between the audits, between the RCMP and between Elections Nova Scotia and this opposition, we will get to the bottom of this and the truth will come out. Why won't the minister stand in his place and ask his colleague, the member from Richmond, to reimburse the taxpayers? Isn't that the proper and the fair thing to do, Mr. Speaker?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. In fact, I reject the argument that's being presented by the member opposite. The appropriate authorities are investigating the actions that have taken place. These are actions that specific individuals were involved with. They made the decisions, and these investigations will ensure that if there was any issues, they will be held accountable for it, Mr. Speaker. But what this government is going to do is focus on what we do have power over. That is the MGA, the Municipal Government Act that governs this province, and we are going to ensure that that act standardizes expenses across the province and ensures that Nova Scotians have confidence in that system so they can be proud of their municipal governments from one end of this province to the other.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. 33-year-old Fliss Croman moved to Canada with her family when she was 8 years old. She's currently being detained by Canada Border Services because there was no adults in her childhood who sought citizenship on her behalf. She's ready to be discharged from the hospital but has no MSI. Oh, Mr. Speaker, the Elizabeth Fry Society of Cape Breton has agreed to house Ms. Croman, but cannot do so unless arrangements are made to address her health care needs. If she continues to have no access to her health card, her only option is to be detained at the Central Nova Scotia Correctional Facility. Mr. Speaker, will the Minister of Health the Minister of Health has the ability, Mr. Speaker, to provide an exemption and reinstate Ms. Croman's health card on compassionate grounds. Will he agree to do so today?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I'm pleased our MLA brought that forward to me yesterday and is being dealt with by the department.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. Fliss Croman is not the only woman in the province in this situation. Deborah Spencer has lived in Canada for more than 20 years and was adopted by a Nova Scotia family. Ms. Spencer has significant mental health issues but cannot access medication she needs because of change in her immigration status. So, Mr. Speaker, what steps will the minister take to make sure people like Ms. Croman and Deborah Spencer don't continue to fall through the cracks?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And there are always, of course, exceptional cases, and it's not always just the department or our hospitals that are responsible for every aspect of a person's life. But we're going to work with these two people as fully and as consciously and as quickly as we possibly can.
The Honourable Member for Dartmouth East.
Thank you, Mr. Speaker. Tuesday, the Minister of Health and I discussed the issue of the doctor shortage in Dartmouth, where I said 30,000 residents are either already without a family doctor or imminently will be. Well, Mr. Speaker, I was wrong. The Health Authority called today, and it turns out the issue in Dartmouth is 23 doctors, not 21, so it's potentially 33,000 patients. Mr. Speaker, this raises the issue of how many vacancies exist elsewhere in the province. So will the Minister of Health agree to table a list of all current and expected vacancy numbers for family doctors by region across the province?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. One of the areas that the Nova Scotia Health Authority is working to get a full handle on is, in fact, the kind of practice that doctors have in terms of the number of patients, how many days a week that they do work, because it's not just sheer numbers. Right now, in 2015-16 year, we had the most doctors, the most GPs working that we've ever had in the province. We need to realize that doctors have some very different practices than traditionally, so we're getting a handle on how many are currently practicing, when they're looking at retirement, number of patients they have, so some of that information will come in due course.
The Honourable Member for Dartmouth East.
Well, Mr. Speaker, in the interest of transparency, the fact is that you can call the Nova Scotia Health Authority and ask for each region, and you get slightly different numbers each day. But to have a good province-wide discussion on this, it would be useful to have that information available to every member of this House. On Tuesday, the Minister suggested that there have been some recruitments from the upcoming graduating class. And so in addition, I'm wondering whether the Minister will table a list of the number of new doctors with whom agreements have been signed, not necessarily their names, and including what zones they will be setting up in.
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I'm pleased to say that recruitment goes on a continuous basis. We now have a strong team in place to look at what the needs are across the province, and I know that probably by January, some of the communities that are without a doctor will get the information that they will need in terms of new hirings.
The Honourable Member for Inverness.
For Municipal Affairs. Twice this week, the Minister suggested expenses claimed by Richmond staff or councillors included members of the Progressive Conservative Caucus. Now, the Minister didn't finger me, but then again, nor did he finger any of his colleagues. So who's to say there's not more of us involved? Mr. Speaker, will the Minister table today the full list of MLAs identified in the information that he has?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. My point is that all of us as MLAs meet with our municipal affairs. All of us as MLAs meet with various stakeholder communities, Mr. Speaker. Any expenses related to those meetings...
Order, please. The Honourable Minister of Municipal Affairs has the floor.
And of course, Mr. Speaker, I speak on behalf of all of us when I say any expenses related to those meetings, we would expect that the regulations be followed to a T. And, Mr. Speaker, I don't think I need to table anything in relation to the expenses I mentioned last week, because the member from Argyll has already admitted to that expense.
The Honourable Member for Inverness.
Well, Mr. Speaker, the Minister is selectively using information that he has to deflect attention from his own party. The Minister can prove with tabling information. It is difficult for me to understand, if I may use the word obvious, because it was used a few times yesterday, the obvious outrage that the government has with this expense scandal, because it's not translating into action. So what is the Minister hiding that is delaying our ability to get to the bottom of what has happened in the Richmond expense scandal for the sake of the people in Richmond?
The Honourable Minister of Municipal Affairs.
Thank you very much, Mr. Speaker. Let's be clear what we're talking about. We're talking about decisions and actions that were perpetrated by certain individuals. The appropriate authorities are investigating the nature of those actions, Mr. Speaker. Let's look at what the Conservative solution is to this particular event. The member from Inverness has suggested we direct the Ombuds office. The member from Pictou West has suggested we direct and involve ourselves in an RCMP investigation and involve ourselves in an electoral investigation by Elections Nova Scotia, Mr. Speaker.
Order, please. The Honourable Minister of Municipal Affairs has the floor.
Thank you very much, Mr. Speaker. Let's look at what the Tories are suggesting we do here. Involve ourselves and interfere in 3 separate investigations.
Order, please. The Honourable Minister of Municipal Affairs.
The Conservatives have asked us to intervene in an RCMP investigation, in an Ombudsman's Office investigation, and an investigation by Elections Nova Scotia. 3 arms of government that, for good reason, are at arm's length, Mr. Speaker. Their answer to this might be to turn Nova Scotia into Putin's Russia, Mr. Speaker, but I'm no czar. I'm simply a public servant, and I will continue to do my job.
The Honourable House Leader for the Official Opposition.
Maybe it's not good that I get up and ask the next question. Mr. Speaker, I'm not going to do it in Russian. I'm not going to do it in Russian, as the member alludes to. Last spring, the Minister of Health told members at this House that we will see a fulsome, comprehensive update on the continuing care strategy by fall of 2016. Seniors across the province have been waiting for many years since the first continuing care strategy was brought forward in 2006. They want to know what the province plans to do with the future of these programs. So my question to the minister, and hopefully he can answer in English, not in Russian, which date can the Nova Scotians expect an update on the continuing care strategy?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. As the member opposite knows, we gave an interim report on the continuing care strategy. Work continues on that final document. He also knows that we've presented our home care improvements, our nursing home wait list, the work on the dementia strategy, which is now out, also working on the acquired brain injury strategy. So there are many components of that that have already had some information presented publicly. The full document will be on its way.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. You know, these citizens have been loyal citizens, have worked hard in our province, and of course deserve at least a return on all those contributions that they've given us. I think, quite honestly, Mr. Speaker, the government has played around with this one a little too long. They have committed that they would be bringing this forward. Seniors have lost faith. I think that the government is going to bring something forward. So my question is, when can seniors expect a full, laid-out plan for the next decade from continuing care from this province?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. First of all, when we reviewed the 2006 document on a continuing care strategy, there were many strong points in it. However, it became a document more about building nursing homes than looking at the comprehensive needs of seniors in our province. And I would finish by simply saying, fall isn't over yet.
The Honourable House Leader for the Leader in the House for the New Democratic Party.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Natural Resources. Many Nova Scotians were angered to learn yesterday that the minister has approved clear-cutting for 94 hectares of forest adjacent to Kitchimacoochee National Park. Mr. Speaker, concerns have been raised that Parks Canada has not even finished their review of this proposal, and yet the minister has already approved this clear-cut. So, Mr. Speaker, I'd like to ask the minister, has Parks Canada finished their review of this proposed clear-cut, and if so, what have they concluded?
The Honourable Minister of Natural Resources.
Thank you very much, Mr. Speaker, and thank the member opposite for the question. The Department of Natural Resources has a terrific relationship with Parks Canada. We're in constant communication on many important areas, and that was accentuated this year because of the proximity of the 7 Mile Lake fire to that gem that we have in Kedgie Park. Parks Canada are telling us that they have no concerns around the proposed harvest in the area. And I might just point out, Mr. Speaker, that in terms of Kedgie as a wonderful facility, 57% of that boundary is against a wilderness protected area, the Toby Attic.
The Honourable Leader in the House for the New Democratic Party.
Thank you very much, Mr. Speaker. The Minister opposite has got one part of the question right. That park is a gym for all Nova Scotians. Mr. Speaker, Canadian Parks and Wilderness Society has come out against the Minister's decision to approve this clear-cut. They stated that there is very good science to show that the 6 hectares of buffer zones approved by the Minister is simply not enough to prevent damages of effects of clear-cutting inside of a protected area, and I will table this. Mr. Speaker, the Minister himself stated in this very House that his department is following science-based decision-making. So I'd like to ask him, where is the science that supports this clear-cut, and will he table it in this House?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker, and thank the member opposite. The wisdom that went into forming Kedgie Park and the wilderness protected areas around the province involves science in its essence. And the wilderness protected areas and the parks are defined by the ecology that the experts in our department, in the Department of Environment and Parks Canada, have sought to determine where these boundaries should be. So with flora and fauna and topographical changes in the landscape, the boundaries are actually defined. So the science exists in the wisdom that has given us and this government 12.24%, exceeding the goal of wilderness protected areas in Nova Scotia. No, you didn't do that.
The Honourable House Leader for the Official Opposition.
I don't know, Mr. Speaker. We did, I don't know. Mr. Speaker, the village of Weymouth has been without a doctor for more than a year. Now, Dr. Westby was on CBC not so long ago speaking of the village's efforts to find a doctor. Dr. Westby said that the health authority hijacked them, and I'll read that quote. We weren't getting any help from the Nova Scotia Health Authority. In fact, they hijacked us. We didn't even know this was in their plans, to remove physicians from the Weymouth area until the very last minute. The Liberal government promised a doctor for every Nova Scotian and claims that they stand by that promise. Yet the Minister allowed the Health Authority to eliminate the position that was in Weymouth. So my question to the Minister is, why would the Minister approve this after promising Nova Scotians would have each a doctor?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. As the member knows, that the model of care that is developing across the province is not one that was simply put together by the Health Authority. It is being driven by doctors over the past 5 to 10 years. Doctors right across our 17 medical schools in Canada have stated very, very clearly that they want to work in team-based practices. Even specialists now are talking about going to regional centres as a team. In terms of Weymouth today, there is a doctor currently visiting there. A nurse practitioner is there. Many patients have migrated to the Clare Clinic, and we'll also see movement to Digby in the future as well.
The Honourable House Leader for the Official Opposition.
Last week, almost 2 weeks ago now, at a public meeting about the lack of doctors, the MLA for the area, the Clare Digby MLA, reported and told the audience that he convinced the Minister to agree to approve a doctor to work in Weymouth if one could be found. And it goes along, told the audience that he had convinced the Minister of Health to agree to approve a doctor to work in Yarmouth if one could be found. This can't be true, Mr. Speaker, if the Health Authority has already removed the billing number and the position altogether. So, Mr. Speaker, my question is, will the Minister reverse the decision and assist the village of Weymouth in their hunt for a permanent family doctor?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And what I can tell the member opposite and all Nova Scotians is that recruitment goes on every day, and we know in terms of the classes that will be finishing up their residency in the spring, we've already made some very good signing of contracts, and we know that area of the province now with the residency program at Dal is starting to see the rewards in that area. As the member for Shelburne, I know, would like to get up and tell us that there's a new doctor from that residency program now practicing in Shelburne.
The Honourable Leader of the Official Opposition.
Mr. Speaker, my question is for the Minister of Health. There is a family doctor crisis in Spring Hill, Mr. Speaker. We're down to 2 doctors to cover the collaborative emergency care centre there. The hours that the ER are closed is going up and up, Mr. Speaker. It's a far cry from what the people of Spring Hill were promised when the CEC was established. In addition, Mr. Speaker, too many people are going without the family doctor they need. I'd like the Minister to be aware of one young woman who is expecting a baby, who does not have a doctor and cannot get the prenatal care that she needs. I'd like to ask the Minister, will he acknowledge there is a doctor shortage at the point of crisis in Spring Hill, so obviously, when a young woman who is pregnant cannot get prenatal care?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. We know in terms of prenatal care, there are a number of programs that are available. I know every young mother would certainly like to have a family doctor who continues to check on her. We have areas of the province where, in fact, nurse practitioners, family practice nurses provide absolutely high-quality, competent care each and every day in this province.
The Honourable Leader of the Official Opposition.
Mr. Speaker, there is no program that can replace a family doctor, particularly for a young woman who is expecting a baby, who needs monthly checkups, who needs prenatal care. I don't think it's insulting to this young woman to say there are programs available when she needs a doctor. Mr. Speaker, there is nothing going on to recruit new doctors to the area of Spring Hill, where hundreds of people are looking for a doctor and want their emergency room to be open. The Minister has the ability to put a locum doctor in place while the community looks for a new one. Will he agree today to send a locum doctor in Spring Hill until permanent replacements can be found?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. Yes, we have set aside considerable millions of dollars this year for locum doctors, and I will do my best to work with the Health Authority to see what a short-term solution can be. But I think the member opposite should not overlook the tremendous value that nurse practitioners, family practice nurses, and midwifery add to the prenatal work of our province.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. Direction 180 is a community-based methadone clinic serving the Greater Halifax area that operates on a harm reduction model. The organization had to reduce hours and actually eliminated a community they service with their mobile unit because of lack of funding. They had requested an additional $350,000 from the department just before summer to help to respond to the growing opioid crisis here in the province and the addiction of opioids. The government just provided, I believe last week, $50,000, Mr. Speaker. It takes $5,000 per person per year to treat the addiction. Mr. Speaker, will the minister agree to provide Direction 180 with the resources they require to meet the growing needs for community-based addiction treatment?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I thank the member for the very important question that he's bringing to the floor here today. We are now working with a whole number and range of providers in addiction services across the province to take a look at comprehensive programs, not just methadone and Suboxone, but what we can do province-wide. And we know that Direction 180 plays a critical role in the delivery of that service. We were told at the department that it would be a little bit over $2,000 to provide the necessary methadone for the list that they had. The bigger ask was around a comprehensive program looking at the future.
The Honourable House Leader for the New Democratic Party.
Great, they're starting to look at what can they do into the future, but here's an organization that is working today to try to save lives, Mr. Speaker. They had to stop going to a community to provide their services. Mr. Speaker, last year up to August of this year, 70 people in Nova Scotia have died from addiction of opioids, Mr. Speaker. Last year, I believe it was around 60. While groups are meeting tomorrow, I believe, to develop a response to the increasing crisis related to the fentanyl problem that we're going to see in our province, Mr. Speaker, Direction 180 and the Allied Centre in Cape Breton are the only two sites in the province that have the pilot project to help fentanyl overdoses, Mr. Speaker. So I'd like to ask the Minister, will the Minister commit today to provide stable, ongoing funding to Direction 180 and the Allied Centre in Cape Breton?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. What we've done in terms of the Allied Centre in Sydney is to look at restoring if not all of that federal grant, to be able to provide at least some transition monies that they originally gave for AIDS, HIV work in that centre. So that is certainly going on. But in terms of the opioid issue, I thank the member for bringing it forward. This is the whole purpose of being proactive and having a group of professionals in Nova Scotia come together, in fact, starting tomorrow, to map out a provincial plan that will be responsive to the current need.
The Honourable Member for Inverness.
Here are my questions for the Minister of Communities, Culture and Heritage. Mr. Speaker, this summer I was at the Broad Cove concert, and for 60 years Broad Cove has hosted one of the most iconic concerts in our province's history. Time has come to upgrade the stage and the talent room. The federal government supported this. In fact, Mr. Speaker, and I'm going to table this, the local MP featured the investment on a mail-out to residents. My question, why didn't the provincial government support Broad Cove with this important project?
The Honourable Minister of Communities, Culture and Heritage.
Thank you for that question. Mr. Speaker, as I travel across this province, meeting lots of community groups and organizations, I have learned that they are extremely proud of their organizations, their local communities. And I will say, my office has always supported any group who's walked into our door. We don't throw anybody away or push anybody away. So, I would suggest
Order, please. Order, please. The Honourable Minister of Communities, Culture and Heritage has the floor.
So, to answer your question, sir, Mr. Speaker, I'm not sure where the application or if they've applied, but I would ask them to come, talk to us, and we will work with them.
The Honourable Member for Inverness.
Thank you, Mr. Speaker, and I appreciate the Minister's words. I know there's a lot of requests that come forward to government, and it's not always easy to answer them all. But, Mr. Speaker, may I ask the Minister to reconsider? And I know in his comments he may do that. People, and for the member from Bedford, I'll have to tell you that, and tell that member that people visit our province every year just for that concert. The public supports this. We see that in the numbers of people that attend the concert. The federal municipal governments support it. Will the province have a second look and support it?
The Honourable Minister of Communities, Culture and Heritage.
Thank you for that. As I've said, have them contact my office. We will look into it. We don't turn anybody away. Thank you.
The Honourable Member for Halifax Needham.
Question is for the Minister of Community Services. We learned last spring that this government was no longer going ahead with the Bloomfield housing project. After more than 6 months of silence during which volunteers with the community partner Imagine Bloomfield were left in the dark, the Premier and the Minister of Community Services walked away from the proposal. This was this government's flagship project for affordable housing. And during the time that Housing Nova Scotia sat on the project, we actually lost affordable housing units in Halifax Needham. 40% of renters spend more than 30% of their income on rent in Halifax's urban core. So I asked the Minister, where is this government's new flagship program?
The Honourable Minister of Community Services.
Thank you, Mr. Speaker. And I realize that the member opposite is new to the House, but that absolutely was not our flagship project for affordable housing. $100 million for a small sliver of affordable housing was not the way forward in this province. We chose to do it through rent supplements. We chose to do it through new build. We chose to do it in many other ways in partnering with developers. Unfortunately, Bloomfield was not the answer or the panacea for affordable housing. When it comes to Halifax Needham, I'll remind the member that there are currently 1,683 affordable housing units between Rainy Drive and the north end of Halifax. And we have added to that by taking on Brunswick Street nonprofit, which we have added, and we've also added a number of rent supplements through that. So there actually has been an increase in affordable housing in that area.
The honourable member for Halifax Needham.
Mr. Speaker, earlier this month, mayors and planners from over 100 countries took part in the United Nations Habitat 3 Summit in Ecuador. A new urban agenda was agreed to that would lay the groundwork in developed and developing countries alike to ensure that housing is considered a right afforded to all. The cost of affordable rental units in this province continues to rise along with the price of property. So I ask the Minister, what is this government doing to act on the new urban agenda and ensure that the department's actions on affordable housing are consistent with viewing housing as a right?
The Honourable Minister of Community Services.
Well, thank you for the opportunity to tell this House what we're doing as a government. We're investing in the next few months, $74 million of extra money that we've partnered with the federal government. We've invested over $42 million of the deferred federal contribution, and that's on top of the $102.5 million that we partnered with the federal government 2 years ago for a 5-year agreement. So through rent supplements, through partnering with private developers, and through new builds, we've actually decreased the waiting list in this province by 10% for the first time in a decade.
The honourable member for Sydney River Myra Lewisburg.
Well, thank you very much, Mr. Speaker. Mr. Speaker, my question through you is for the Minister of TIR. First, I want to say thank you to him and his staff for attending several meetings in the community of Grand Myra South regarding the roads and the issues there. And going back to the Minister of Municipal Affairs, the roads are like Russia there. So I just wonder if the Minister... Not yet. Soon, very soon. That's the answer this government has for everything. Soon, very soon. Mr. Speaker, my question to the Minister is, can he give us an update on the plan for the road in Grand Myra South?
Order, please. Time allotted for oral questions put by members to ministers has expired. We'll now move on to government business. The Honourable Government House Leader.
Thank you, Mr. Speaker. Would you please call private and local bills for second reading?
We'll now call private and local bills for second reading.
Would you please call Bill number 47, the Halifax Rifles Armory Association?
Well, now, just before we call Bill number 47, the Halifax Rifles Armory Association, I'd like to direct all members' attention for an introduction to my speakers gallery. I'm honoured to have here with us today a couple of distinguished residents from the constituency of Eastern Shore. We have with us here today Mr. Jim Livingston. Please stand, Mr. Livingston, who's a resident of Lake Charlotte. Jim is a retired air traffic controller and has served 66 years as a member of the Halifax Rifles Armory Association, currently serving as the Vice President.